This week we're talking about how to treat rotator cuff injuries, but first, our disclaimer. Mike Matthews, physical therapist here with the PT411. Thanks for joining me. If you already haven't done so, make sure to check me out on Facebook, YouTube, Instagram, TikTok, and Twitter. Subscribe and hit the notification bell as well. Also, make sure to check out thept411.com. So this week that we are talking about the rotator cuff injuries. Last week we talked about diagnosing them. We went through some clues and pain behaviors and some specific testing to do with each of those four rotator cuff muscles to see if this is the injury, if this is what we are dealing with. So if you haven't seen that video, make sure you check out that one first. We don't want to waste our time treating the wrong problem. Now the rotator cuff takes a lot of time to heal before we can see any improvements, even with the right treatment. If we're wrong about it, we will not know for some time, so we need to be very clear that that is the problem that we are dealing with. So yes, it does take time to heal. If we apply any treatment at all and it responds very quickly, like within a treatment or up to a couple of weeks, it is not the rotator cuff. The muscle and tendon unit does not heal that quickly. It can take up to 4 to 6 weeks just to see any sort of positive difference with treatment. Since it's the contractile unit related to a tendon and or the muscle, we have to load it to facilitate the healing process. This unit will not heal on its own. It depends on input to adapt. We don't apply force to it. It doesn't have a reason to heal and strengthen. And which muscle we determine is the problem can definitely change how we work on strengthening it as well, which treatment that we end up providing. And as we go through these muscles and these treatments, keep in mind that we're looking for something very specific. There's a Goldilocks zone of symptoms that's telling us we're doing just right, just enough, not so little we're wasting our time, and not so much that we're just perpetually injuring the structure. We want the exercises to be moderately painful while we do it. We want the pain to linger a little bit when we stop the exercise. We don't want the pain to linger longer than 5 minutes. Now we work these exercises 3 times a day, 20 times each time we do it. We progress the resistance or we move on to the next exercise progression if we aren't getting that pain that we're looking for anymore. Or if we're getting a little too much, we get that major pain or we get that pain that lingers longer than 5 minutes, we take a step back, we step backwards in the progression. And be patient. It can definitely take time. It can take days to weeks before we can step it forward with the resistance or moving on to the next exercise. Now, first, we're going to talk about the Supraspinatus, Infraspinatus, and Teres minor. They're very similar. We go through the same exercises and the same progressions. Just make sure that we're getting that Goldilocks zone with those symptoms. Now, if you move on to the next step and it's not producing the pain, go ahead and skip that step again. And we're going to start off here with external rotation. We find a resistance band to work this movement. We pull out away from the body. Keep that elbow at our side. As the symptoms lessen, first we add more resistance to it. Progressing past that exercise, we work the empty can lifts. We have the arm between forward and sideways. Keep the thumb pointed down. Now make sure you're lifting slowly. We start with the weight of the arm. From there, we can either use our resistance band or a hand weight, or we can alternate between the both. Now, the next exercise is rotating outwards in abduction. We start off with that elbow a little bit more out to the side. We might have to play with the angle some. Some may need to actually raise the elbow out just a little bit at a time. Some may need to go all the way out to that 90-degree angle. Elbow stays fixated as we rotate the arm upwards there. Once we get to that 90-degree position and not getting the symptoms that we need, it's time to progress even further. Now we start with both of our elbows at our sides with tension throughout the band at the start. We maintain that resistance as we raise the arms up. Keep those elbows at about that 90-degree angle and maintain that tension and just slowly go higher as it allows. Now once we can get through full motion with that exercises, symptoms are lessened, we progress to just that face pull. We start with our elbows forward, bent 90 degrees, we pull apart. As you do this, put emphasis on keeping the elbows more forward than the hands, working those reps. Now, if we're looking at treating the subscapularis, it's a different set of exercises, a different set of progressions than the previous ones. Now, we need to start off with internal rotation. We pull the arm in across the body, keep the elbow bent at 90 degrees, tucked in. Increase the resistance first. Progressing past this exercise, we step away from our anchor and we start with the arm out to the side. We pull the arm in at the same time we rotate internally across the body. Still allow for that full external rotation when away from the side during that negative. Again, progress the resistance first and then on to the next exercise. Now this next exercise, we're placing the resistance, that anchor more above us and rotating down while the elbow stays bent and out to the side. Go through full motion, progress with the resistance, then on to the next exercise. So at the last exercise for the subscap, we start with the resistance behind us, that anchor behind us, elbows out to the side and bent. We keep the elbow and the upper arm in the same place as we rotate inwards. At the same time as we do that, we step forward with the opposite foot, pivot the body around the shoulder and the arm like this. We'll show several reps of this one. It's not quite as straightforward as the others. Now, as we get towards the last couple of exercises on either of these progression lists, we need to start incorporating our daily lives, our normal activities and routines. This can be daily chores or movements we couldn't do before, even workouts and exercises that we want to get back into. We can even start introducing more sport-specific activities and throwing programs. We start off small with these and we progress things along as, again, we listen to those symptoms, staying within that Goldilocks zone, just slowly progressing with those. Now, on the other side of things, sometimes the rotator cuff injuries are just too far gone. Therapy will not help in all cases. Sometimes when problems are very severe, they'll line up with the clinical exams and imaging. Surgery may be the first option. Sometimes weeks of therapy prove not to help. Now, I do still highly recommend just trying PT. You may be surprised and get relief where you're looking for. You might be able to avoid that surgery, which is a literal and figurative pain. Now, but if surgery is inevitable, definitely stay tuned. Next week, we'll be looking at what to expect after the rotator cuff repair surgery. Again, I'm Dr. Mike Matthews, physical therapist here with the PT 4-on-1. Thanks for joining me.